morning to all. I am Roshni Dhabi, nursing tutor of Index Nursing College. My topic is Healthcare Team. Introduction. The healthcare team consists of a group of people who coordinate their particular skills in order to assist a patient or his family. The personnel who comprise a particular team will depend upon the need of a patient. Definition: Healthcare team means two or more health professionals work in a coordinated, complementary, and agreed upon manner to provide quality, cost effective, evidence based care to patients. The team may include physicians, physician assistants, advanced practice nurses. Hospital care team. Hospital care team includes many different practitioners. Uh, First, attending physicians. The attending physicians is the leader of the team and has responsibility for all decisions made that affect a person's care, including diagnosis, treatment, and supervision of the remainder of the team. Based on the problem that brought the person to the hospital, the attending physician may be a hospitalist, a doctor who is trained in internal medicine and works only with people who are hospitalized, a surgeon, or another specialist physicians. In smaller communities, the person's primary care doctor may act as the attending physicians. Residents, interns, and medical students, house staff. Some hospitals are designated as teaching hospitals, that is, the hospital team includes medical students who are at various stages of education and who are supervised by the attending physicians. A resident or intern is a fully licensed doctor who is engaged in further training after graduating from medical schools. Although these team members are not attending physicians, they are often active members of the team. Specialist: when people have complex or serious medical problems, the attending physicians sometimes request that specialists evaluate the person and recommend how to best diagnose and treat the problem. For example, the specialist may be a doctor who is extensively trained in the diagnosis and treatment of disorders of the heart, cardiologist, kidney, nephrologist, or cancer oncologist. In other cases, the specialist may be a surgeon who has particular expertise in one area, such as the brain, spine, and nerves, neurosurgeon, or muscles, bones, and joints, orthopedic surgeon. Registered nurse. People usually have more contact with the registered nurses (RNs) assigned to their care than any other member of the team. RNAs give drug to pupil and monitor and evaluate their physical and emotional needs. When a person's condition suddenly changes, RNAs are often the first to detect the change. RNAs then report the changes to the attending physician or house staff. RNA may be charge nurses or nurse supervisors organizing and monitoring overall nursing care in a hospital unit. Licensed practical nurses. Licensed practical nurses (LPNs) are supervised by RNs and provide basic medical and nursing care. For example, LPNs check blood pressure, insert catheters, and help people bath and dress. LPNs also talk to people about their healthcare, answers their questions, and report how they are doing to RNs and doctors. Nurse practitioners and physicians assistants. Nurse practitioners and physicians assistants work closely with the attending physicians to coordinate a person's daily care. They also help with doing physical examinations and ordering drugs and treatments when people have more common or routine medical or surgical problems. Although nurse practitioners and PAS are not doctors, they have advanced training in diagnosis and treatment. Nurse practitioners and PAS are supervised by doctor. Patient advocates. Patient advocates are non-medical administrators employed by the hospital to assist patients receiving care there. In general, they handle complaints that people have about their treatment or healthcare providers. People can meet with a patient advocate if they feel uncomfortable discussing concern directly with their healthcare providers or they feel that their concerns have not been addressed. Patient care technicians, traditionally called nurses, aides, patient care technicians help nurses with pupils' care. Their duties may include obtaining vital signs, measuring blood pressure and temperature, moving pupil to and for a bed or wheelchair, helping pupil with walking, providing items for pupils' comfort such as pillows and blankets, sometimes helping feed pupils who cannot feed themselves. Physical therapist evaluate and treat people who have difficulty functioning, for example, difficulty walking, changing positions, or transferring from a bed to a chair. These problems may develop or worsen in the hospital because people have to stay in bed a long time. Bed rest as may occur after surgery or because their disorder worsens. Physical therapists assist pupils' strength, endurance, and coordination and design brief in hospital exercise program to help people function better physically and become more independent. Often, physical therapists help doctors determine whether people are likely to be able to function on their own at home after they are discharged from the hospital or whether they may need help at home or need to stay at a skilled nursing facility for additional physical therapy. Next, occupational therapist assess pupils' ability to do their daily activities. These activities include eating, dressing, grooming, bathing, using the toilets, cooking, and cleaning. Occupational therapists can recommend strategies and devices to help people function more independently. Speech pathologist. Speech pathologists work closely with people who have had a stroke or who have another disorders that interferes with swallowing or communication. For example, if a stroke causes problems with swallowing, speech pathologist recommended that the person eat foods with the certain textures. They can suggest way to swallow that can prevent food from going into the lungs instead of the stomach. They also evaluate the thought processes involved in the communication. Hospital pharmacist. Pharmacists specialized in how drugs work and interact with each other. Hospitals have pharmacists on their staff who supervise the use of drugs in the hospital. If needed, hospital pharmacists teach people how to safely and effectively take the drugs prescribed for them. For example, pharmacists may advise people to avoid specific foods that interact with their prescribed drug or teach people how to inject drugs, such as insulin, at home. Hospital pharmacists also provide information to doctors and answer questions about specific drug actions and interaction. Next, social workers. Social workers provide support, information, and education. They help pupils prepare for discharge from the hospital by identifying and arranging helpful services that can be provided in the home and community. For example, they may refer pupil to a skilled nursing facility if pupils are not well enough to return home and need ongoing care and therapy after discharge from the hospital. Social workers also coordinate certain home health care needs, including a visiting nurse or physical therapist and medical equipment such as wheelchairs and hospital beds. Dietitians. Registered dietitians have specialized nutritional and medical training that helps them determine a person's dietary needs and plans the person's meals in and out of the hospital as requested by the attending physicians. When planning meals, dietitians consider the person's personal, cultural, and religious food preferences. Certain medical conditions have very specific dietary requirements. For example, people with diabetes need a low sugar diet, and some people with kidney problems need a low potassium diet. Dietitian can advise people about which foods safety these requirements and which foods they should avoid. Other team members. Other staff members may be involved in a person's hospital care. They may include a radiologist and radiology technicians, a respiratory therapist for people with breathing problems, staff members to help transport pupils within the hospital, clergy, and hospital volunteers. Thank you.